Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. Many families in intensive care come to us and they want to know that if you are a BIPAP user at home and you go to hospital, do you need to go into ICU? That's a great question to ask. Let me break this down for you. So if someone is at home on BIPAP, either with a mask or with a tracheostomy, they definitely need to go into ICU when going into hospital, because it requires the specialist skills of intensive care nurses to look after BIPAP, whether with or without a tracheostomy. You know, the risks when somebody needs BIPAP ventilation of things to go wrong, such as barotrauma, pneumothorax, is high. And I'm surprised that Nancy, who asked this question, doesn't have any support at home, because that's what it sounds like to me. So you definitely need to go into ICU because it requires the specialist skills of ICU nurses, ICU doctors to look after patients on BIPAP. And Nancy, I'm surprised, you are at home on BIPAP ventilation. You should hire a service such as intensive care at home that sends intensive care nurses into the home 24 hours a day. So you don't have to go into ICU in the first place. So that's my quick tip for today. Yes to ICU if you go to hospital if you're on BIPAP, but no to ICU if you hire a service like intensive care at home that can look after you at home with ICU nurses 24 hours a day. Check out intensivecareathome.com for more information. This is my tip for today. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.